Hello again, guys. How are you doing? This is Hans. I wanted to go over a few things. We've been receiving a lot of questions regarding when are we going to resume treatments? Why have treatments been stopped? At the beginning of March, we started noticing this was going to be something serious. We started following all the recommendations coming from the government and health institutions regarding social distancing. We kept on our treatments until the 19th of March when we received recommendations from the European Society of Human Reproduction and Embryology to not proceed for embryo transfers, inseminations, not get women pregnant. At that time, we still didn't have any data to make sure how safe was it to be pregnant or not in the presence of this pandemic. We did not proceed with further cycles. We finished the ones that we had been already started, but proceeded to freeze all the embryos and not transfer them. Those embryos are kept in our lab in perfect conditions. Now, after the government lockdown, we were forced to close the clinic since we did not consider we were essential workers, and it was going to be very difficult for patients to come into the clinic and back to their homes. So we've remained closed, but we are planning to reopen very soon. But before, let me talk through why we believe that it's going to be safe to reopen the clinic. Essentially, are fertility treatments urgent? I guess we would not be able to consider fertility treatments urgent, but definitely they are very important and time sensitive. These are treatments that a few months can definitely affect prognosis in certain group of patients. And we believe that we can still perform certain treatments without putting anybody at risk. Fertility does stop with age, guys. So this is something that we are keeping in mind. We have not forgotten you. We are advocating in your favor. Our treatments risky? That is a good question. Look, way back we did not like freezing embryos. We liked transferring embryos fresh. These things have changed. And back then, we exposed many women to the risk of hyperstimulation syndrome. We had somewhere around 8% of our patients having some sort of complication. Nowadays, with the changes in medication, with the changes in our protocol, this risk has dropped for probably under 0.5%. If we consider that in Ireland there's around 5 to 6 thousand cycles of IVF a year, we're talking about probably 30 cases admitted in a hospital. That is not much. One of our main concerns of continuing doing treatments was to not overload an already saturated health system. And we believe that with these treatments, we will not be doing that. How are we planning to reopen? This should be starting early in May. We will start with low numbers. This is something that we've never experienced before working in the midst of a pandemic. So we're going to start with low number of cycles. We are going to have to prioritize in patients that we might consider are of more urgency than others, and we will be only doing freeze all cycles. We will not be transferring embryos. I will explain why in a little minute. No other treatments will be happening, no inseminations, no frozen embryo transfers, and no time sexual intercourse. We will try to limit the exposure to our patients to 15 minutes. Every personnel that will be in touch with patients will be wearing the appropriate protective equipment, and we will be working with two teams in tandem just in case one of the teams gets infected. We do not have to close down the clinic. We will also be asking the collaboration of patients to please, if they suffer any symptom that can be corresponding to coronavirus, to COVID-19, I'm sorry, please contact us. We would have to stop the treatment and avoid anybody else in the clinic, from personnel to patients, getting infected. Will we be breaking any national recommendations? We sincerely do not think so. The government allows for primary care, general, specialist medical practice activities, either public or private. We are one of them. We will be adhering to strict social distancing recommendations. As I said before, All the personnel in touch with patients will be wearing the personal protective equipment. And look, we have been hearing this coming from a lot of patients. We do agree. We do feel there's a level of correctness in what they're saying. Look, there is not a single governmental organization, body, nor scientific society that is asking couples that are trying naturally not to try. Why are infertile patients any different? I am sure we will be listened to. We are trying to push forward, and we are in communications with the European Society to try to lift this ban. And as soon as it is lifted, we will resume our treatments. We just do not want to go against what guidelines are recommending at the moment. We are fighting for you guys. We will move things forward. I am very sure of that. Okay. Have a wonderful day. Take care of yourself, and we'll talk soon again.